With the Delta variant, we are seeing increased number of cases amongst children. In the last couple of weeks, the American Academy of Pediatrics has reported a significant increase in COVID-19 cases amongst people under 18 years of age. We know that Delta variant is much more transmissible than the other prior variants of COVID-19, and that extends to children as much as to older teenagers and adults as well. What we're still working to understand is whether people get more sick with Delta variant or not. These are somewhat surprisingly difficult things to tease out. When you have a large increase in the number of people getting infected, that proportionally results in more people in hospital and more people dying, but it doesn't necessarily mean that the virus itself is more deadly. The most important thing we can do to protect kids under 12 years of age who are not yet eligible to be vaccinated themselves is to ensure that as many people who are around them and who are interacting with them are vaccinated. So anyone over 12 years of age should really be getting their vaccine, both to protect themselves, but also to protect people who are not yet eligible, like children under 12 years of age. We know the vaccines are highly effective in preventing serious illness, hospitalizations, and death in people who get the vaccine. We also know that they will significantly reduce your risk of spreading the infection to someone else if you are one of those very rare breakthrough cases we've been hearing about who still gets infected despite being vaccinated. I want to emphasize those cases are getting a lot of headlines, but they're very rare events, and they are not what is driving the current surge in cases that we're seeing. The current surge is really amongst unvaccinated people, predominantly young and middle-aged, who are winding up in hospital or in ICUs because of infection. And we know that these are largely preventable hospitalizations and deaths that we're seeing now because the vaccine is so extraordinarily protective against landing in hospital or dying from this infection if you get the vaccine. We do want kids to return to school. We know that all the benefits of going to school. But right now, with what's going on in our country and in our communities with Delta variant spread, you're really making a choice between getting vaccinated or getting COVID-19. This Delta variant is just that contagious. And so we know that the vaccine is safe and effective in kids and teenagers over 12 years of age. And so we're highly recommending that they all get vaccinated before they return to school.